When we think of climate change and its effects on our daily lives, hospitals don't usually come to mind, but they should.
Yeah, think about it. Many large healthcare facilities, they're open 24/7, 365. And that not only means a lot of power consumption, but also the release of emissions into the atmosphere. But as News Center Maine's Drew Peters shows us tonight, one of the state's largest healthcare systems is adapting to help protect Maine's changing climate.
According to a study from the National Academy of Medicine, the healthcare industry is responsible for about 8.5% of all greenhouse gas emissions in the U.S.
We own hospitals, these large buildings. They never close. They're full of equipment that take a ferocious amount of electricity. We're always having to change the air over to ensure that things are clean and sterile inside.
With the organization of a climate health team and through steps to reduce their impact on the environment, Vice President of Facilities and Chief Environmental Sustainability Officer Tim Doak says they're hoping to change that.
We're part of the problem here, and we really need to find a better path forward and be part of the solution.
According to Doak, one of their biggest priorities is to reduce Northern Lights' carbon footprint through things like electric and hybrid vehicles, as well as cleaner energy sources.
We've looked at changing facilities, making things more efficient, using less electricity, pivoting away from fossil fuel-based things.
Another initiative to reduce emissions from hospitals across the state is the elimination of desflurane, an anesthesia gas that, according to officials at Northern Light, is 2,500 times more potent as a greenhouse gas than carbon dioxide.
That small change, I think, has a much larger impact, not only on our local community and the community health, but just on a global scale as well.
Manager of Environmental Sustainability Jennifer Boothroyd says it's not just about changing the way Northern Light operates, but also informing people about the ways climate change can impact their health.
It's been really important that we be there to provide these educational resources to the community members that we serve.
Through these community discussions and changes in operation, the climate health team at Northern Light says it hopes to make Mainers and the rest of the world a little bit safer from the impacts of climate change.
Make not just our facilities more resilient to long-term climate change, but also our patients and our employees.
In Bangor, Drew Peters, News Center, Maine.
And one of the next steps at Northern Light is to reduce the use of nitrous oxide gas. It is another commonly used anesthesia that is 300 times more potent of a pollutant than carbon dioxide.